My name is Sarah, and I'm here with Jillian, Weslin, and James, and we are all student registered nurse anesthetists volunteer representatives for the American Association of Nurse Anesthetists, and we are part of the Government Affairs Division. In this presentation, we are going to be talking about the SWOC analysis, which is the strengths, weaknesses, opportunities, and challenges on the full practice authority of advanced practice registered nurses at the Veterans Health Administration. As a quick introduction, the VHA proposed a plan to allow APRNs, including CRNAs, to practice the full extent of their education and licensure to expand veterans' access to health care. However, there was a lot of opposition from physicians and medical professional associations, and the final ruling ended up not being completely what was originally planned. So we are going to cover our analysis of this issue.
Hi, my name is Weslin. As Sarah mentioned, I'm also a representative for the American Association of Nurse Anesthetists. I will be introducing the strengths of our SWOT analysis. The Institute of Medicine released a report titled The Future of Nursing, Leading Change, Advancing Health. This report supports advanced registered practice nurses to practice to their full scope of their education. The umbrella of advanced registered practice nurses is composed of clinical nurse specialists, clinical nurse practitioners, clinical nurse midwives, and certified registered nurse anesthetists, also known as CRNAs. CRNAs have been providing anesthesia services in the United States for over 150 years. They have proven to be competent in surgery, labor and delivery, pain management, and emergency medicine. Currently, the U.S. Army, Navy, Air Force, Indian Health Services, combat support hospitals, and forward surgical teams allow advanced practice registered nurses to practice without physician supervision. The Centers for Medicare and Medicaid Services now allows states to opt out of the federal Medicare supervision billing requirement, meaning that CRNAs are no longer required by the CMS to be supervised by physicians when administering anesthesia. To date, 17 states have opted out of the federal supervision requirement, and the cost efficiency of autonomous CRNAs in these states has aided in controlling the escalating healthcare costs. The American Nurse Association, the American Association of Nurse Practitioners, the American Association of Nurse Anesthetists, the Association of Veteran Affairs Nurse Anesthetists, Veterans, the Military Officers Association of America, the Air Force Sergeant Association, other veteran-led groups and stakeholders, and more than 75 members of Congress have communicated their support for full practice authority of CRNAs and advanced practice registered nurses in the Department of Veterans Affairs, also known as the VA. The Federal Trade Commission has also voiced their support as it benefits the VA's patients, the institution itself, by improving access to healthcare, containing costs, and expanding the innovation of healthcare delivery. The VA currently employs more than 6,000 advanced practice registered nurses, all who can be utilized independently to improve the availability of high-quality care to millions of veterans.
Hi, my name is Sarah, and I'm one of the representatives for the American Association of Nurse Anesthetists, and I'm here to talk about the weaknesses on the government legislative side of the full practice authority issue of advanced practice registered nurses at the VA. So the VA, in their final ruling, granted full practice authority to nurse practitioners, certified nurse specialists, and certified nurse midwives, while excluding certified registered nurse anesthetists or CRNAs from the final ruling. So CRNAs still do not have full practice authority at the VA. Nursing professional organizations like us and the American Nurses Association are frustrated with this decision, because we have been able to provide information and evidence to the VA on the cost effectiveness of CRNAs, on positive patient outcomes from CRNAs, and patient safety. We've also been able to prove that there are shortages in areas of anesthesia in the VA, including gastrointestinal and cardiovascular surgeries. We've also been able to demonstrate the usefulness and need of CRNAs without physician supervision. So we feel that the VA is not taking advantage of the opportunity to utilize all of its providers fully, which would help maximize their use of resources. So, some weaknesses in the campaign for full practice authority of advanced practice registered nurses is, for one, the campaign against full practice authority was a lot more extensive. For example, the American Society of Anesthesiologists created a website to help facilitate comments against full practice authority. And because of that, they helped create the 104,256 comments that were made against full practice authority, while there were only 45,915 comments for full practice authority. Also, the American Medical Association utilized the VA's 2015 Mission Critical Occupants Report as an argument against the RAND assessment. And this report actually helped strengthen the claim that the VA made about the shortages in the areas of gastrointestinal and cardiovascular surgeries being because of issues with hiring and retaining anesthesia providers, which they claimed was also a greatly improving issue. So the ways that we could have helped improve our campaign was by making it more extensive, and also by having more research, either to prove to the VA that there were shortages, or research that was showing that the improvements that were being made in the hiring and retaining of anesthesia providers were not actually resolving the shortages that were present in the gastrointestinal and cardiovascular areas of anesthesia.
Hello, my name is Jillian, and I will be discussing opportunities on the government legislative side of the full practice authority issue of APRNs at the VA. Advanced practice registered nurses should engage legislators in the clarification and systematic review of the existing barriers that have hindered APRNs from practicing to their fullest extent. They can partake in consultative meetings, lobbying activities, and initiate dialogue with legislators to become acquainted with them and to share evidence-based information. Once acquainted with legislators, APRNs can serve as expert resources among the representatives' constituents, which lends the APRNs the ability to collaborate with legislators and inform them on how implementing a particular policy will translate into practice. The number of veterans seeking care services is likely to increase, meaning new care delivery models, including integrated care, medical homes, and health information technology, will need to be used to adequately care for this growing population. It will be critical for the survival and success of these new care delivery models if all 6,000 APRNs currently employed by the VA can use their full scope of practice. Increasing the scope of practice of APRNs will improve the accessibility of quality care to veterans. Through APRN full practice authority and new care delivery models, veterans will have access to integrated, collaborated, and comprehensive care, rather than episodic care, that would enhance their safety, satisfaction, experience, and the efficiency of the program. As a result, expanding the scope of practice of APRNs will significantly reduce the cost of care. It is important for APRNs to improve their political advocacy skills, gain knowledge of the legislative process, and consider political activity to be part of their nursing role to enhance their active engagement in the policy formulation process. An APRN's engagement in policy will ensure their grasp on available opportunities to engage legislators and government on issues pertinent to both the profession and the patient's health needs. That way, the legislative process gives APRNs an opportunity to be advocates for their professions and their patients, making them more effective providers. Lastly, APRNs should engage in clinical studies whose findings will inform their political advocacy, policy deliberations, and care delivery process. The clinical studies that should capture the evolving care needs of the veteran population seek expanded opportunities in policy formulation process to transform the care provided to these veterans and show how APRN's work can provide cost savings and improve patient outcomes. Through this process, APRNs can prove to be effective advocates for the veterans and can use this position to influence policy and propose innovative models of care to policymakers.
Everybody, my name is James Pyle, and I am a representative from the American Association of Nurse Anesthetists. Today, we're going to take a look at a few key challenges that CRNAs face in practicing to the full extent of their education and licensure. One challenge is the opposition from the American Society of Anesthesiologists and various other medical societies. The ASA have created a website to facilitate comments against the full practice authority of CRNAs in the VA. The comments that come from this website have made strong arguments against CRNAs. The ASA have also attempted to discredit any research completed by the AANA that claimed no difference between the care provided by anesthesiologists and nurse anesthetists by calling them poorly designed and self-funded. These groups have made it clear that CRNAs should only be able to operate under their direct supervision, and by removing them would lower the standard of care and could possibly jeopardize lives. Ultimately, these comments lead to the exclusion of CRNAs from the final ruling on full practice authority in the VA. Physicians have shown that they will vigorously oppose any policy that could affect their jobs or their medical hierarchy. There are political barriers as well. The CMS has recently allowed states to opt out of the requirement of CRNAs to be under the supervision of a surgeon or an anesthesiologist to receive reimbursement, yet 33 states still have not opted out. We must overcome these challenges to gain full practice authority in the VA as well as the United States. Thank you.